Hi, my name is Patrick and I'm a trainer in the School of Health and Applied Sciences. Today, I would like us to go through some few vital signs. And I'm going to be starting with blood pressure. It is very important for everyone to check their blood pressure every now and then because it could be an indicator of something quite terrible. Now, it's very important before you start your test that you organize your equipment. So I have my blood pressure machine here. Then it is also very important that I sanitize my hands. So I'm going to sanitize my hands. If you can wash your hands, actually, the better. So I'm just doing this because what I have is basically my sanitizer. And I'm going to invite my patient for today. So I'm going to ensure that my patient has taken some rest before we go through the procedure. I'm going to ensure that this line goes alongside this vein here. Hand here should at least have be at the same level as the heart, and then this is a digital blood pressure machine. Therefore, what is required of us would just be to press the power button, and the machine is going to do everything else for you. And therefore, that should give us our estimated blood pressure. And as it is, our patient's blood pressure is actually high, slightly higher than the normal range. The normal range should be around 120/80. And therefore, 150, 78, slightly high. We are assuming that the young man has been exercising, and probably that is one of the reasons. And therefore, it is important for our patient to continue checking their blood pressure so that they can ensure that it's within the normal range. And if it continues to be high, then we would advise our patient to actually visit a healthcare center for further diagnosis. I'm just ensuring that my batteries are okay, well set, in readiness for the test. For this test, I will only need a finger from my client. And my client today is Mercy. Mercy, how are you? Yeah, today we just want to check on your oxygen levels in blood. Shall we proceed?
Yes.
Thank you very much. So just any finger, and you should be able to start it there. And there is no pain that you're going to feel. So you should just should not get worried. Then I'll put it on. As you can already see, we have an SpO2 of 97, which is within the normal range. The normal range is 94 to 100, so your oxygen levels are very okay. This machine is also supposed to give you your pulse rate, which is the rates, the heart rate per minute, and yours is 57. Slightly below the normal range, which is 60 to 100. So still normal, yes, but slightly below the normal range. So those are your, and it's actually rising. So, I mean, still within the normal range. 61, still within the normal range. So that gives us a proper estimate of your SpO2s, that's your oxygen, and your pulse rate. And I'm happy to inform you that you're actually doing well, very healthy. So you just go ahead and withdraw your machine, and you can still switch it off. So you ensure that you have your machines properly kept for the next test, and once you are done with everything, very nice, then you can go ahead and remove your gloves. Now, removing the gloves is a very important skill so that you can avoid soiling your hands, contaminating your hands, because you could have done a very good job in ensuring that you do not get into contact with anything that is wet, sticky, and not yours. But you could actually contaminate yourself at the point of removing your gloves. So this is very important. After handling every patient, ensure that you have properly sanitized. So the proper sanitization should include in between the fingers. If you are washing your hands, then you would wash even at the back of your hands. The palms, you ensure that you really wash the palms, and in between the fingers, and dry your hands before you can engage in any other activity. I'd like us to go through yet another vital sign, very important for checking out our health status, and that is the sugar levels. This is what informs whether you have what we call pre-diabetes or diabetes, either mellitus or insipidus. Therefore, it is very important that we keep checking our blood sugars every now and then. I have my patient today, Bradford, Karibu. Today, I would like us to check on your blood sugars. You're good with that? Yeah, so I'm going to prick your finger. You're going to feel some little pain, whichever finger that you have, just a little prick, and that will be it. Enough blood, and I can go ahead and prick. That should do. And I have this here. This should give us measurements. I have this. You can hold that. That gave us a measurement of 4. This needs to be disposed of properly. Ensure that you dispose of the lancet that you used. Important that you collect everything that you used, and dispose of properly. I would like us to go through the procedure of a self-test for HIV and AIDS. It's very important that you organize all the tools that you're going to be needing. So I'm going to need a self-test kit. Today, Anne is going to be our volunteer patient, and she's already granted us consent to test. This is just a preservative. This is going to be used in drawing blood. This is our alcohol pad for sterilizing, where we are going to be drawing our blood, and this is our buffer. So we will need all that ready for use. You're going to feel a little prick, just a little prick. But remember that this test should be repeated again after 3 months. So if it is a negative, then after 3 months, you would need to do another test so that you can confirm whether you are actually positive or not. There is a single test that is known as the control. So if we only have one line, that is one band, at the C here, that means that the test is negative. If we have another line at the T, so by the end of the day, if we have 2 lines, then that is going to be a positive test result. So as at now, we can see our tests forming, and we only have a single band, which is the control test. And if we could have had another band just where we have the T, then that test should have been positive. And we can continue advising Anne to continue being safe. And if you must engage in sex, then it has to be protected. And the only protection that actually prevents HIV and AIDS is the use of condoms, either male or female. And our clinic is usually open for such tests. We will continue talking about the impacts of HIV. We'll continue talking about the various methods that can prevent HIV and AIDS, so that we keep on reducing the statistics of HIV in Kenya and in the world.